painful urination, or that difficulty in urinating, or that burning sensation when they are passing out urine. So when someone has a UTI, oftentimes there is that difficulty or burning sensation or painful urination. That is a hallmark feature for someone with a UTI. These UTIs, like as I've said, they start to colonize from the outside part. So they start from the urethra. When they colonize, you experience cases of dysuria. And when I say dysuria, this is burning sensation when you're urinating, or painful urination, or that discomfort when you want to pee. But when left unchecked, it can progress, and it can progress up to the bladder. So when it reaches the bladder, in most cases, it will be causing that need to empty the bladder all the time. So there's that increased frequency in urination, or that urge in urination. So again, when this is left unchecked, it can progress up to when it reaches the kidneys. And in most cases, when it reaches the kidney, it means you have really not cared about treating this infection. And in most cases, even the treatment is longer. So in a nutshell, for the case of UTIs, depending on the progression, the symptoms may just keep adding. Yeah. But the hallmark features: one, there is that painful or discomforting urination, or that burning sensation when someone is urinating. Two, there is that increased urge to urinate. So there's that increment in the frequency. Sometimes, when it has maybe progressed to reach blood, someone can present with fever. Yeah, there are those that present with fever. Now, in the issue of the men, for example, the men, there are other organs which can get involved. For example, the prostate. And in most cases, when it is left unchecked, you find that such men may experience what we call perineal pain. Yeah. When I say perineal pain, I don't know if you know the perineum. For the purpose of the people out there, the perineum is that diamond-shaped space between the thighs, from the pubic symphysis up to the tailbone. So that space houses the external genitalia and even the anus. Yeah. Now that space is important because it houses what we call the pelvic muscles, and these muscles play a key role. Maybe when someone has gone to defecate, maybe during intercourse, these muscles play a key role. Now, these muscles, when someone has like a UTI and has affected the prostate, remember the prostate is supported by these muscles. So when there is inflammation, there is also that pain that radiates to that perineum. So in most cases, men with prostatitis, meaning UTIs that have really affected the prostate, they tend to have perineal pain, and that's a hallmark feature. Yeah. So in a nutshell, for the case of UTIs, it depends on the progression, and that's when the signs may slightly differ. But over and above that, the commonest, there is that difficulty in urination, and then also frequency, increased urge, there can be fever, and then there can be perineal pain for the case of the men.